So today we're reporting nearly 20,000 new cases of Covid-19, with 373 people in hospital, 9 of whom are in ICU, and just under 100,000 active cases across the motu. Now, I know that such a high daily case number can be concerning for people to hear, and many of us will have whānau members who now have Covid-19. But it's important to remember that Covid-19 now is a very different foe to what it was at the beginning of the pandemic. And with 97% of new people over 12 years of age who have now had at least one dose of the Pfizer or another vaccine, for most people, Covid-19 will be a mild to moderate illness that can be managed quite safely at home. The big shift in moving to phase 3 is the change in our approach to testing. PCR testing has served us incredibly well for just over 2 years as we have sought to find and respond to every case of Covid-19 at the border and in the community. And that included it playing a major role in the control of our Delta outbreak that started last August and that we had very nearly got right in control of before Omicron appeared. But with thousands of new cases each day and nearly 20,000 today, we did reach the point last week where wide use of rapid antigen testing became both useful and appropriate. It also became clear that PCR testing capacity was not keeping up with demand. So pooling of PCR tests where samples can be combined and all tested at once has been used throughout the pandemic to help improve the capacity for PCR testing we have. Typically, samples are pooled with about 3 to 5 samples during the early stages of an outbreak to increase the processing throughput. For example, during the August 2021 peak of the Delta outbreak, some labs increased pooling to 8 to 10 samples per run. And we continued to use pooling in the early part of this outbreak. However, it becomes less feasible to pool when test positivity rates rise, due to the likelihood that there will be at least one, if not more, positive tests in each group of pooled samples. For example, last Thursday, that's 2 Thursdays ago, prior to the wider rollout of rapid antigen tests, 17 of the 20 DHBs across the country recorded positivity rates of more than 5%. Now, it's important to point out that prior to the 7th of February, so less than a month ago, none of our labs had ever exceeded that 5% threshold. The swift increase in positive cases right across the country effectively prevented labs from using pooling in the space of just a couple of days. At the same time, lab capacity was being affected by some other factors. There was lab staffing capacity as a result of the prolonged workload in responding to the outbreak and people needing to be rested. There were vacancies and some lab workers also tested positive for Covid-19 and couldn't work. There were some limits on reagent supplies because of global supply chains. All of that means it's now clear that we overestimated the number of tests the lab network could actually process once Omicron began to take off, and take off it did quite rapidly. So the rapidly increasing case numbers across the country and these other factors has led to a delay in the processing of around 32,000 samples. I've been working closely with the Minister and explained this situation to her, and our team's been working very hard over the last few days with the labs around the country. And I want to apologise to people whose tests results have been delayed. In some instances, but so saying, our labs are committed to processing all those tests. And those people will get a result even though it's been delayed. We have sent text messages out to those people whose results have been delayed, encouraging them, if they still have symptoms or have developed symptoms, to go and get a test. And of those who received the text, around 12,000 had gone and got another PCR, or most of them, a rapid antigen test. So when those results come back for people, in some instances, the result may be less sensitive than usual due to the delay in processing. There's a loss of sensitivity that may affect the negative result, but all positive results will be a confirmation of Covid-19. If we had recognised this delay a little earlier, we may have been able to better redirect and share capacity around the network. But once the samples are in a lab, it's very hard to take them out because they're in the system and move them to another lab. We've also used other things to help reduce this backlog, including sending just over 9,000 tests to Queensland over the weekend to be processed to help clear the backlog. I do want to emphasise that the delays are not the fault of our labs or the staff there. They have been working incredibly hard right through the pandemic and have done phenomenal work over these last few weeks. But we're addressing the situation. And just again to emphasise to anyone who had a PCR test on the 23rd of February or earlier and who is still waiting for your result, if you have symptoms still or have developed symptoms, then please go and collect a rapid antigen test from your local testing centre, or you can contact Healthline for advice. We are sending a text message today to all those who are affected. And again, most of these people have already had an earlier text message. So the shift to phase 3 and to the use of rapid antigen tests has made an immediate impact on relieving the pressure on our labs, and a big drop in the use of nasopharyngeal swabs and samples arriving at our labs. So it has got down to much more manageable level over the last 24 or 48 hours. We've seen strong uptake of rapid antigen tests by people with symptoms or who are close or household contacts, by organisations who provide critical services, and indeed right across the health system, to test both staff and people coming into hospitals and into other places like aged residential care to help supporting the safe delivery of care. General practices and urgent care clinics across the country, and particularly leading out in Tamaki Makaurau, are rolling out supervised rapid antigen tests, and they will now have unsupervised tests to hand out to people. And if people do need to pick up rapid antigen tests, the HealthPoint website has an increasing number of sites on there, or places on there, where you can go to collect them. Already more than 40,000 people have self-reported a positive rapid antigen test result. And in fact, of the nearly 20,000 cases today, only a couple of thousand of those were PCR confirmed results. The rest were people self-reporting rapid antigen test results. This is incredibly important for us understanding the extent of spread. And I want to thank those who have and encourage everybody who returns a positive rapid antigen test to please upload that result online through My COVID Record. We now have plenty of rapid antigen tests in the country. We distributed over 5 million around the system in the last 7 days. We have 12 million in our central stores, and we're expecting over 16 million to arrive this week. So we are well supplied. The challenge is distribution, with some of the logistics networks staff being affected by the outbreak, but we are getting tests out as quickly as possible around the community. And just for those people who are going to pick up rapid antigen tests, what can you expect? Well, if you're unwell with symptoms, you will be offered testing kits for yourself and your household and whānau who may also be contacts. You will be given enough for 3 tests per person and provided on guidance how to undertake the test at home and how to record this in My COVID Record. If you go to a GP. If you go to a community testing centre, you will be given 3 tests per eligible person. Whereas if you go to a place where, for example, you're a critical worker and you go to a community pickup centre, they can be pre-ordered online, and you again will be given 3 tests for everyone in your household. So we're not just giving them to the person who is the case, they can take them home for their households to use. Okay, in phase 3, our health system has been preparing, and our hospitals are keeping up with the demand that is there. Again, 373 people in hospital today. What we've seen in the Auckland region over the last few weeks is that the average length of stay in for people in hospital is quite short, 2.2 days. This is around half of what it was during the Delta outbreak. So people are going and requiring some care, mostly on the ward. The vast majority of people are not requiring any respiratory support either on the ward or in the ICU. We have good capacity across our hospitals are ready for this, and they can look after other illnesses. So please, if you are unwell and require care, ring Healthline, see your GP, or if it's an emergency, please do go to the hospital. At the moment, our hospitals across the country are about 80% of occupancy, which is actually a bit lower than it has been, and our intensive care units about 57% occupancy, so we have the capacity there. But only a small proportion of people with COVID end up in hospital. Most look after themselves and their family at home, and there are many others who are getting care from their GP or another community provider, and sometimes social supports as well. It's been great to see good uptake of self-service tools. Around 54% of people notified by text that they are a case in the last week have then followed up with a case investigation form online, and that helps us to target support to those who are at high risk. And at the moment, we've got about 90,000 people being managed through our nationwide clinical database, which is called the COVID Clinical Care Module, and that just makes sure that people are getting the care they need. Finally, well, New Zealand, like just about every other country in the world, has not escaped Omicron to date, but where we can be an exception is how well we minimise the spread and the impact of the virus and protect people as much as possible from it. What has helped us so far to do so well with this pandemic is doing the basics well, so please continue to do so. Wear a mask to protect others and yourself. Physically distance, practice good hand hygiene, and most importantly, stay home, don't go out if you're unwell. And please be particularly considerate of those who may be the most vulnerable to the virus, older people, people with disabilities, or with pre-existing conditions. There's no doubt the next few weeks are going to be tough. The health system can't do it alone, so thanks in advance to all New Zealanders for continuing to support our efforts to live with the virus on our terms.